Here we have collagen mainly type 1, that it's more rigid, less elastic. And then we have formation of new collagen type 3, the yellow and green color. I don't know if you have red touch. You already have red touch? No? Okay, so... yeah, maybe. Let's see. That was the previous red touch, the old prototype that we used for many years. The main difference with Red Touch Pro is the possibility to deliver in motion treatment. This is a big innovation for us because before having Pro, we used to offer a very long treatment because we had to treat our patient with stamping mode, staying still for many seconds, and the shape was really, really small. So we took a very long time, and even patient perception was a little bit pain because they were feeling like tingly, like needles. Even the cooling system improved, so now patient feels nothing at all. And we can deliver both fractional emission or Moveo technique. DEKA did a comparison even for the efficacy, because with the previous Honda, the maximum power was 10 watt. And from this sample, we can see that by using more or less the same amount of dose, amount of dot, in a specific area, but with the Red Touch Pro we can increase the power at 15 watt, we can penetrate much more into the tissue. So we have more efficacy, for sure, because we go deeper in dermis layer, so 33% depth increase, and we save 50% treatment time. So we are really able to deliver a very short, fast treatment. Okay, this is the database, the settings. We are gonna see 3 different parameters when we decided to use a standard technique. So fractional emission, standing still. So it's a little bit longer treatment. I normally do the standard technique just in case I want to treat a very specific area. So for example, I have melasma just in this area, I'm gonna use standard technique. Or I have just 2 or 3 dark spots, I'm gonna treat standing still on the dark spots. If I wanna do rejuvenation treatment, skin laxity, if I wanna improve the brightness of the skin, the elasticity of the skin, I always use Moveo. Faster, safer, and painless. Anyway, standard technique, you have power, dwell time, and spacing. We have to play with these 3 parameters based on our photoskin type. So for sure, if I have a darker photoskin type, I have to decrease everything, apart the spacing. Dark photoskin type, I increase the spacing, but I decrease the power and dwell time. If I have a lighter photoskin type, I can do the opposite. So I can increase power and dwell time to be more aggressive, and I can decrease the spacing. Then you can, with standard technique, you can decide which shape to use based on the area you want to treat, even the size. And the cooling system is set at 5 degrees. I normally maintain 7 instead of 5. You can decide, as in CO2 fractional laser, you can decide if you scan in normal way, interlast way, or smart track. I normally use normal scan mode. Then you can select the settings from the database. You have all treatments in the database for treating melasma, in which kind of photoskin type, for treating dark spots, phototype 1, 2, 3, up to 6. So it's very easy to use. Here you have database. So you can follow the indication of database and then save your favorite settings. Okay, in Moveo technique, Moveo is the treatment that I mainly use every day because, as I said before, it's very fast and painless. And you can catch everything. So when I do Moveo on the entire face of my patient, actually I'm doing skin tightening, I'm working on wrinkles, I'm lightening the dark spots, I'm working on rosacea if the patient has it. I'm improving the acne scars if my patient has acne scars, so you can cover everything. So my suggestion is to do always Moveo technique. We set a certain dose, actually is total amount of dots to emit in 10 by 10 centimeters area, and power. So dose is always the same. So I normally treat this area 10 by 10 and I deliver 3,500 dots. The power can change based on the photoskin type. So if I have photoskin type 1, I can use the maximum, like 15 watt. Patient will feel nothing at all. If I have a darker photoskin type, I go down, like 10, 8. If I have photoskin type 5, 6, maybe I have to deliver at 6, 7, no more, okay? And this is the countdown bar to see how much energy I'm delivering, okay? So my protocol normal is 3 treatments, Moveo technique. I will take about 10 minutes for face and neck. Then, if I have a specific blemish to treat, after the Moveo, I can focus my treatment with standard technique, staying still, just on dark spots or just on some scars, maybe, just to be more aggressive. Okay. The use is very easy, so if we have men, I suggest to shave very well the bird, because otherwise they jump on the bed because they feel a terrible tingly feelings. So it's better to ask to the patient to shave the same day of the treatment. For women, it doesn't matter for sure, but if they have some very light and thin hair in women treatments, they feel like tingly feelings, and they could have some little crust where the hair was, okay? It's normal. So we clean the skin, we put some ultrasound transparent gel for sliding with the handpiece, and we do the treatment. Then we remove the gel, we apply some moisturizing cream. If you have a very strong reaction, in particular if you treated the patient with stamping mode, you can put some antibiotic cream. But normally it doesn't matter. And we propose at least 3 sessions. Actually, I know that if you push up the parameters, you can see results even after 1. I never say that to my patients. I always tell them to wait for 3 sessions, but the results are really amazing. Okay, when we decide how to treat the patient, if we treat in standard technique, so fractional way, normally we use quadrant shape and we stay still. But when we use Moveo, we have just a line. And we have to scan this line on the face of our patient. If the line is horizontal, you see, I will move the handpiece vertically. Then at the half of the dose, I turn the handpiece, I put the line vertical, and I slide the handpiece horizontally. We have to cross, I want to scan the face, okay? With Moveo, with standard mode, we have to stay still. We can do a very little overlap. But for sure, we take more time. Okay, if you want, I can even skip the video because I'm gonna show you the treatment later. Wait, this is the standard techniques, staying still. We take some seconds, depending the settings. As you can see, we can treat even darker photoskin type. And then we have moveo technique. So you see now the line is horizontal and we move vertically. I always stay in contact. I never move away the handpiece. I always stay close to the skin. This is a post-treatment erythema that you could have, not always. It depends. If we have a very sensitive skin or maybe on neck reacts much more compared to the face. Or if you could have in standard technique, in stamping way, these possible side effects. The formation of little scabs, they fade in few weeks, very difficult to see, so they can cover with some makeup. Actually, sometimes happens when you have a dirty handpiece. So I recommend to clean very well the glass. Or if the patient has many hairs. Let's see melasma. As I mentioned before, working with 675 nanometers, we target mainly collagen. And I say mainly because we are very effective even on melasma and vascular lesion. Why? Because collagen is contained even in the blood vessel wall. So in the wall of the blood vessel, we find elastic fibers and collagen fibers. So we have the shrinkage even on this kind of collagen. For this reason, rosacea improves because we can make the blood vessels tighten, more tightened. And we exactly know that melasma is characterized by an increased vasculature in the lesional skin. We know that where we have the dark spot of melasma below, if you take picture with quantifier, a 3D camera, you can observe that we have an increased number of vessel size and numbers of vessel. So we should try to stretch, to make this vessel tightened. We discovered this during the clinical study. We didn't know that, actually. Fillers interaction. Actually, we have no interaction with fillers. So you can perfectly treat a patient who has injections in her face. You see, in some case, the penetration is different. With retouch, we stop here, and hyaluronic acid is below, so we have no interaction, no hyaluronic change. But even if we are denaturating the collagen among the hyaluronic acids, we have no change in the fillers, okay? I suggest not to do the two procedures in the same day. In the same day, no, we wait some days. Okay, rejuvenation clinical cases. Okay. This patient underwent one treatment, and I took picture after 3 weeks, more or less. This is a quantifier camera, and she said, I can feel any results. It's normal after one treatment, but for curiosity, I took picture again, and the results, in my opinion, is amazing. Look at the hypopigmentation. Hypopigmentation, because it's a biostimulation. So we repigmented the hypopigmentation. Hello, welcome. Hi. We are ongoing to work on dark spots because we need 3 sessions, but actually she improved. And the skin tightening is amazing. The wrinkles here. This is after one. Look even the double chin, the jawline area. This is really nice. Not always like this. Based on my experience, I've seen that if I have a very skinny and flabby face, I can get immediately results after one treatment. If I have a more fatty face, I need more. Or even if I have very deep wrinkles, I need more. Or I need, even for speeding up, the combination with other devices. For example, if I have some fat, as in this case, I combine Onda. There is no more Onda here. Onda works on fat reduction, and immediately after I do retouch, for example. This is a partial results. This is 2 sessions, okay? But actually she improved. This is after just 3 sessions, sorry. Look, another patient who told me I can't see results. So be careful, take picture every time, you know better than me, because only retouch. No, at all. And actually, before having retouch, we were used to obtain this kind of results, we were used to do HIFU, Ultera. Ultera works very well, in my opinion, in particular in this area. Actually, it's very painful. They need anesthesia. And for seeing results, you need to wait many, many months, like 5-6 months, based on my experience. And it's very expensive. We can obtain more or less the same results, in my opinion. In my opinion, much better, because we work even on skin quality, because we are working with a laser, with a diode. This is really nice. I have many patients, so maybe here there is too much light. Yes, you can. But I think is the screen is very... Prova a spippolare se riesci a metterlo un po' più scuro. Qui non si vede il tubo. From my laptop is more visible. Anyway, even in this case, maybe there is too much light in the screen, but we improve a lot the barcode. Even in this case, you see the detail. This is one treatment with stamping mode, because this was the previous retouch. You see the detail here in the nasolabial barcode. This is just one treatment, and we take picture after 3 or 4 weeks, not immediately after. Skin quality and dark spots. You see, we always are able, this is quantifier that shows us the lifting effect. This is one treatment. You see, in this area works terrific. In the jawline area works extremely well. This is a cheek area, little detail, skin laxity. You see the skin quality improves, not just the wrinkles, not just the laxity, not just the dark spots, but the skin brightness, the skin quality. Look at the rosacea. So actually, you cannot split treatments. So you cannot decide to treat just rosacea or just dark spots. Actually, you cover everything. I think this is the key point of this device. Look, this is the vascular lesions. And this is what we see. This is a partial after just one treatment. You see the double chin? Even if you have a very skinny patient, you can really tighten the skin. This is after, I can't see, but looks three sessions, yeah. One session, so ongoing. 3 sessions. When we have these very deep wrinkles, we can get good results. If you have CO2 laser, the combination is amazing because retouch works on deeper dermis to do a tightening, to do a rejuvenation. If you do even a cool peel or fractional laser, a stronger one on the top with CO2 or a Morpheus Vivace C needles RF, the results are amazing. Dark spots, décolleté area, just one treatment. You see how much less melanin. Dark spots. You see? This is after 2 sessions. This is the change of volume. Less melanin on the skin. And then vascular lesion. Wrinkles, 2 sessions. This was with the previous retouch, so with standard technique. Now it's much easier and faster. This is what now it's very commercial to say, glow treatment. Everybody wants a glow treatment. So this is perfect to do that. Then if you have other devices, we can combine with many procedures. It works extremely well, even standing alone, as you can see. We can do even on darker photoskin type. We have even darker skin going on. And we saw that we have good improvement on lip enhancement, maybe on lip moisturizing effect. It's not a filler, it's not an injection, the results is not the same for sure. It's better to do in standard technique here. It's a very quick treatment. We do 3 passages. It's very painless because the power is lower. You see the lips appear more moisturized. See? We normally do 3 sessions. Even in this case. This after 2 sessions. And was curious because actually I treated the barcode, not the lips. But she had an improvement even on her lips because we are tightening, we are stretching the barcode area. Let me show you some acne scars cases. Normally, we were treating acne scars with fractional laser, with very aggressive fractional laser. The problem was the downtime, the recovery time, because they were really swollen and red for 10 days. So not every patient wanted to undergo that such strong procedure. In this case, we have 0 downtime. This is a weapon to use. And the results are really impressive as fractional laser. In this case, I prefer to work with stamp technique. Generally, if you want to be more aggressive, you have to play with standard technique, standing still. 1 session, just 1. Even in this case, just 1. Playing with standard technique, you can decide if even the stack. If you want to go deeper, to be more aggressive, you can use, in this case, they used stack 3. She has very light skin, so they could do that. On darker photoskin type, it's better to stop at stack 1. But you see the skin quality immediately improved. This is after 1 session, even with very low parameters, 5 watt. But you see the doctor here enlarged the spacing, 1500, to be less aggressive. 1 session. Even here, we normally propose 3 treatments every 3-4 weeks. This is after 3. Pigmented lesions, again, we have some cases. Which is the same patient. This is the melanin view. Maybe here there is a video. Okay. I normally do treatment in smaller area. So for treating an entire back, it takes a long time and it's quite expensive. I normally do face, neck, and décolleté area and hands. This is immediately after 1 session. This is what has to happen, okay? So we have a darkening of the dark spots, totally normal. The darkening lasts around 7 days, more or less, and then the dark spots start becoming lighter and lighter, till disappearing. Okay, this is after just 1 standing still with stamp mode. 1 session. Here again, 1 treatment, pigmented lesions. Here we have. And it works very well, and it makes sense for what I said before, on PIH. So post-inflammatory hyperpigmentation, we can improve the situation because normally in PIH we have a vascular component. So catching melanin and vascular lesions, we are able to improve these kind of dark spots. 3 sessions, for sure. When we have a darker photoskin type, we have to work with lighter parameters, so we need at least 3 sessions. On lighter photoskin type, we can be stronger, so maybe with less session we can reach very good improvements. Look at this after 2 sessions. This is after 1 treatment for this patient. We are still ongoing, working on dark spots, so she needed more. You see, less melanin on the cheek and much less vascular lesions. Even hands treatment is really nice to do rejuvenation, to do dark spots. This is a Japanese patient. Now with Retouch Pro, I prefer on this kind of patient, this Japanese photoskin type that are really sensitive, I prefer to do Moveo technique. This is really nice treatment. 4 sessions. And you see, when I speak about to cover multiple blemishes, it means this. It means that I'm doing skin tightening. Here with this particular camera, we can see the improvement after 3 sessions. This is a very difficult melasma to treat. You see how much melanin we have and how much vascular lesion we have. Before and after. Here we have the classic zone, the classic area on barcode, like a mustache. Before and after, less melanin. Here we can see visible results, but even from this picture, and less vascular component. Another melasma case. And look at the melanin. This is a slight melasma. You see how we work on this area, obtaining the melanin reduction. She's my colleague. She has a very bad melasma, Michela. And this is after 2 sessions, stamping mode. Less melanin and less vascular component. And look at this patient. This is a very dark photoskin type, very difficult to treat. We can't treat with other techniques because it's very dangerous, because we could obtain an hypopigmentation. So parameters, you see, do you remember the Korean men where we use 5 watt in stamping mode? Here, in a darker photoskin type, we use 7-8 watt because we are in Moveo. In Moveo technique is much lighter treatment because we are not concentrated the energy in one spot, okay? So we can raise up a little bit. You see, less melanin. Even on this very dark photoskin type on forehead, she had a very good response. Less melanin, before and after, before and after, before and after. We have good improvements even on stretch marks. We have even Tetra Pro, we have CO2 lasers, so normally we treat stretch marks with CO2 laser. But actually, in particular on darker photoskin type, where fractional laser could be a little bit more dangerous because we have the shadow of the treated area for many months, we can use red touch. This is 2 sessions. Oh, sorry, I don't know. It's skipping. 2 sessions again, non si ferma. Okay, this is, sorry. Let me show you. Okay. These 2 treatments. Actually, we are breaking the collagen fibers, so we have. Sorry? Actually, you can treat both stretch marks, white and red, because catching vascular lesions, you can improve even the red one. Yeah. This is side effects. Okay. Maybe we exaggerated with the power. And here, I don't know if you can see these little scabs. Maybe the energy was too high. We are able to treat even alopecia. It's a very long path, so we normally do a very long protocols made by 2 sessions per week for 2 months, then 1 month, 1 session per week, and then 1 session every 2 weeks. The power is really low, 1 watt. So patients feel nothing at all, even because we don't want to burn the hair that he has. We work just with stamping mode, but the results are really, really interesting. They did some studies on it, so we have some publications. It's a quite long treatment, but the results are really amazing, and for sure we need the maintenance. We can combine with a very light fractional laser called PEEL, for example, for stimulating the tissue on the head. We can combine with a PRP, with red touch. This is the last patient we treated. And then we have many publications speaking about this particular frequency on scars. Yes, I think they have publications. They can send them to you. Yeah. And then I want to spend a few words about the last combined protocols that I did on our clinic. This is the result of one treatment made by 1-PRX peeling, trichloroacetic acids. Immediately after, I did retouch Moveo, so 5 minutes, 10 minutes, okay? And immediately after, I deliver a cool peel, CO2 cool peel. So it's a fractional laser with lower parameters at 3 watt. And immediately after, when my skin is damaged by the cool peel, the fractional laser, I put exosomes. Exosomes allows me to have a much shorter recovery time after the cool peel. So this is the result after 2 weeks, 2 or 3 weeks after the treatment. I think it's really interesting. And the recovery time, this is the following day, almost 0. You see much redness here because she aids her pores on the nose. So on the nose, I push up the parameters with CO2 laser. But look at the rest of the face. It's a very slight redness. I did it for me, this trio, I call it trio, 1 week ago. I was red the same day and the following day. That's it. But it's a redness like to take sun. Okay, I finished my presentation. I don't know if you have, thank you. If you have some questions, or do you want to see how to do the treatments? Yeah, we play with the machine. Okay. Think about that the line scan dot by dot with 7 dots. So if I go too fast, I don't give the time to the line to scan. So I go a little bit slower. Now the line is in this way, this position, and I'm scanning horizontally. Here they feel tingly feelings, you see. She's not loving this area, I know. Now she will feel a very strong light. It's normal. When I reach the half, so here I have this bar that make me see how much energy I have. When I reach the half, I change the movement.
You mean half like 1,500? Or what?
The half of 3,500. When I reach the half, I'm about to reach it. I change the movement. I'm going to show you. Okay. Now I change. So now the line is in this position, and I scan the face vertically. Can you ask her what she's feeling?
شو حاسة حاليا؟ شو حاسة؟ في ألم؟
She's sleeping.
في ألم؟
لا شكشكة بسيطة خفيفة.
هي ما حاسة بشيء.
What
She
she
does
said?
not feel anything.
Okay, that's good. And ask her what she feels when I go here.
هلا عند التم في ألم؟
الشكشكة عند الطنب شوي.
Little bit.
Tingly. Did you take pictures for her?
Before, yes. We will take after.
يعني لازم تاخذ كمان شو بروفايل بيكتشر. Next time. قد ايه عمر البيكتشر؟
قد ايه عمرك؟
70.
ما شاء الله. لا عشان
أهلا وسهلا.
ما بيخوف ما بيخوف. ما في داعي.
Okay. Almost finished this side.
So you pass twice on the same area but in different directions?
Yes, I pass more than twice.
More than.
Yeah. Look, I start again from this side. So think about here in this line. So in case I have, for example, very deep wrinkles on the barcode, after Movio, I can do standard technique just on the barcode.
How about next time on the pigment here? Or
Yes.
we have to wait to the second treatment?
It would be better to wait for the second treatment. Actually, today I'm gonna treat her with standard technique just to show you.
So after 1 week or 2 weeks, we can make start for her or the pigmentation?
No, we wait for the second session after 3 weeks. Okay. Are you okay? It works very well even in the dark circle. Better with standard technique.
So you can make some stamps.
On dark spots?
Yeah.
Yes, I'm gonna try today. Normally I wait for the second session. Okay. I'm gonna treat even forehead like 500 dots because it's very sensitive area. We are very close to the bone and they see a terrible light. It's okay? Here I go a little bit faster. Okay. Now if you want, I show you how to treat the dark spots. So go back. If you want to go to the database, this is a doctor. This is a doctor I treated. You see the line is horizontal?
Yes.
And I go vertically. What are you feeling? Tingly. Tolerable?
Yeah.
On face is much more tolerable because here the skin is very thin.
Very, very bearable. See? لا. And when you will stop? All right. When you will.
When I reach the half, more or less,
and you should do
is vertical, and I go horizontally.
You go over the previous
The
line.
opposite, yeah.
والله حلوة. خل اسوي الايدتين. خاف تطلع واحدة تطلع انصاف. ما بحب انصاف الحلول وانصاف I want to do my second hand. حلو حلو حلو.
Okay,
Thank you.
done.
Yeah. So will it be different from this one?
You are so young that maybe it's difficult. It's difficult. You have no dark spots. You have no wrinkles.
It could be for rejuvenation.
Yeah.
Thank you, doctor.
She wants rejuvenation. But actually, we are going to improve even these slight dark spots, rosacea, little.
Yes.
She has little acne scars. So actually, if you do Moveo, you catch everything. This is the power.
Yes.
My experience. Because look, if you go to the Moveo database, for example, main blemish, she wants skin laxity, maybe okay. You have to select photo type. She's between 3-4. So, but if you select this, look, 15 watt, the maximum. If you select 4-5, 5. You have to go in the middle. Okay? So what I do is to select these and decreasing. Oh,
هو بيشتغل سكارز بيشتغل
10
بالبلازما
okay
وبالفيكسيشن. هذا لازم نوعية
always the same but to be more effective 3500 is better.
means
How many
collagen.
dots you give per
Yeah, per area, per 10 by 10. Yeah. And this line scan doing 7 dots. 1, 2, 3, 5, 6, 7. Okay? For this reason, I go a little bit slower to give time to scan these 7 dots. If I go too fast, I don't give time to the line to scan.
No need to treat the forehead. Only,
Okay. Okay.
She jumps in. It's okay, no?
It's okay, it's okay. This amount of dots is for half face and this line here. If you want to treat even neck, you have to add some dots more
There
later.
is no forbidden areas to cross or touch with laser. You can go anywhere, right?
Yeah. Stopping here. I don't go over the
Orbital rim.
yes, because you're too close to the eyes and
Yes,
they
yes.
see a terrible light. The light is not dangerous, it's noising to see because it's very strong. Okay. So I don't understand if to put like this or like this. Maybe like this.
The other way around.
Okay.
ارفعي راسك شوي.
Okay. I'm gonna treat this side. Tilt. Okay, great.
أنا بخفض الرفع.
Ready?
أوكي. ما في بيجمنت.
It's fine?
Yes.
This is the speed. Now you see the line is vertical. Okay, so you scan horizontally.
No pain.
No pain?
Mm-mm.
Okay.
You go 4 times in the same area, right?
I scan all the face. Then I go back and I start again. This is a little bit more noisy because there is some hair. Now you see the light, don't worry, it's normal. And now I go down.
الضوء كتير قوي.
احنا شايفين تحت جلدك.
حاسه بعيني.
So you see, I pass again over the same areas.
So you have to do more than one pass
والله
Yes,
شوفي تحت الجلد.
in a linear.
yes, till I reach the half. I continuously scan the face. Then if you see more flabbiness on the jawline, you insist a little bit more there. Now I reach the half, you see,
يا ريت بنتي.
and then I
وجع لي عيني.
rotate the line, okay. Now the line is horizontal and I go vertically.
عم بوجهوك عيونك
لا الضوء كتير قوي بداية.
اوكي
The light. Anyway, they're gonna feel light. They're gonna see light. Even if you close your eyes, even
I will
if you
close
put
it,
a
yeah.
dark, yes, I know, but you have always to think about the position of the line.
It's
Because
vertical now, no?
if the line is like this, you cannot scan in this way. You are doing nothing. You have always to scan. You can even move your hand, but scanning always in this way, okay? Never in this way.
You mean the line should be perpendicular to the skin?
To the direction, yes. So if I go down, the line is like this. If I go up, it's like this. If I want to turn there, I have to turn. Now the line is in this position. I can't go this way because the line is not in the proper way. Think that the line has the same position of this piece, okay? So you look at this and you understand the position of the line.
Why you are doing this?
This square in the face, because I always do the same path. So I pass through the double chin, jawline, go back, nasolabial fold, cheek.
What about the nose?
Molds, no, if you want, you can cover with a white pencil, but I never insist. Yes, but you can go over the molds, no problems at all. Okay, so she has some redness, see? It's normal, okay?
Yeah, she's trying to cover all the ends.
Okay. Ready?
And for seborrheic dermatitis.
Actually, we are trying to work even on this kind of patient. Actually, we are getting improvements. Even on those pathologies where you have inflammation, you can improve. I had a patient with, wait,
I'm trying to get it.
Yes.
The direction is downward, so the line has to be vertical.
exactly. Yeah.
So do I press here?
No, you're ready.
Ready?
Okay.
Good.
Try to reach until here. Think about
From
the
here.
line position. Yes. No.
No, not like this.
Yeah.
Okay.
Try to do until the half. Try to do always the same movement. So, tune, 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 tune. Slower. Okay.
Okay, this is
For
easy.
the half. Then
Okay.
you tilt and always up and down.
Okay, I see. Okay. Okay, now like this, right? Up and
Now,
down.
reach the half.
Oh, you mean okay?
Yeah.
Let's go back.
Okay.
Is the speed fine?
Very good. Yeah. Try to go even here.
Oh, okay.
Even if she doesn't love to go there, but
Is it annoying to the teeth?
for the hair.
Only the hair.
Try to work even here.
قولي لي النظارة أنزل لك إياها.
Very good.
We are halfway.
Yes.
Now we have to tilt it and go
Yeah.
other direction.
Are you okay? Okay.
The hair is it burned? It gets burned? The hair?
A little bit. Yeah.
شعطنا لك حارات شوي.
Very good. Till here.
I did that.
Finish the path. When you go up, you have to go down until here. As you can do a wider movement, so less aggressive. Very good.
السبب بيكون إنه الكولاجين أقل.
It looks tiring because it's the first time, so you are very concentrated, but normally it's a joke. Yeah.
She's asking why some areas are more painful. I think it's just depending on the area, right?
When patient has more hair, maybe here, maybe here in the upper lip, or even neck, it's more sensitive. It's normal. Okay, done.
خلصنا بقول لك نوجع بالأماكن اللي فيها.
Try to catch this.
طب شو أعمل أنا؟
Okay, ready? So here we have, you see these dark spots here? I'm gonna treat these dark spots. Let's see how.
You will do the standard one, right?
Yeah. From database, it says to use 3 watt. Maybe I can increase up to 6. 75 dwell times, so the pulse duration. And spacing, normally I use 0 because I want to cover the entire lesion. This case, she has a darker photoskin type, so I go to 500. Be careful because the shape of the handpiece is circle, but actually the area you treat is quadrant, so try to catch the dark spots. Okay, now we wait a few seconds to see the darkening. Already, you see? It's getting darker now. Okay, I try to treat even this. I'm treating another dark spots, not the same. Okay, they are getting darker, you see? I treat even this. This is lighter, so it needs more energy. So I'm gonna use 8.
We can move her face.
Yeah.
ممكن نمشيك لهون شوي. في طالع هيك.
This. It's much lighter, so I increase the power. It's okay?
في ألم؟
No.
حرارة.
Done. Okay. During the following hours, these dark spots will get darker, okay? The darkening will last 1 week, more or less, and then they start becoming lighter. Okay.
And we can repeat the session after 1 month?
3 or 4 weeks. Even this, if you have,
For hair.
yeah, just for cleaning the face. So 3,500, 3,500. If you want to treat the neck, we add 2,500 more. The neck here. Yes, because we have already treated until the thyroid, yes, the upper neck, 3,500. Then if you want to add this area, 2,500. Sì, 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 ora anche il décolleté. Okay. Someone of you has some dark spots on the hands? Do you want to try just to feel the feeling? Ready? Good? Welcome. Okay. Do you have something for cleaning the handpiece?